Good evening, everyone. All right. The main reason for this session is, of course, we know the dates have been announced for the NEET SS 2025 examination, and the new proposed date is December 27th and 28th. All right. The earlier date, tentative date, was November 7th and 8th. Now they have postponed it by more than a month, almost a couple of months. All right. So how to go about the next couple of months so that you can succeed and get your dream seat in that NEET SS. All right, so that's what we are going to discuss. So as the dates got postponed, we are left with almost about 10 weeks. All right, and this is the time to be smart. Okay, we cannot just go through all the materials and try to mug up everything. It's not possible. All right, but if you prepare yourself in a smart way, uh, have a good plan, there is high chance that you can succeed and get that seat which you want. All right. So generally, I always tend to think that there are three groups of candidates preparing for these kind of exams. The first group is, I would like to call as the rigorous group. All right. They are either doing their residency, almost completing the residency, or they have completed the residency like almost a year back, and now they are rigorously preparing for the NEET SS paper. All right. So they already have a set plan and they are following that. And possibly they had planned for the exam to be on November 7th and 8th, and now they need to change their plan. All right. Now, the second group is the residency group, those who are doing their residency and they are very much focused in doing the residency properly and at the same time studying, all right, studying mainly for the MD paper uh, and uh, uh, and towards the end of the residency program and after the MD exams, which I think will be happening in November. Now they have started thinking about preparing for NEET SS. All right. And finally, we have something called as the third group, which is the working group. Usually, these people uh, have already completed their residency and they are working somewhere. And at the same time, they want to get into further education by going through the NEET SS. All right, they want to go into the super specialty. But at the same time, they are not in a residency program right now. But still, if they are being faculty, like senior residents in an institute conducting a residency program, they still have very high chance of getting into this NEET SS, getting through the NEET SS. So all these three groups, if you prepare, if you have a proper plan and if you prepare, there is a good chance of succeeding the next NEET SS paper. Uh, that means if you are preparing well, being smart for the next 2 months, there is a high chance that you will get through this NEET SS paper. All right. So whatever group you belong to, it doesn't matter right now. All right. Next couple of days, I want you to take an off or a break from your studies. Okay. It doesn't mean that this break time is for you to party or watch movies or go visit your friends and family. It's not for that. But this break is essential to regroup yourself. All right. So if you're belonging to the rigorous group, you already have a set plan. Now, this is the time to revisit your plan. Okay. You need to adjust your studies according to the new timeline. All right. And if you are in the second group, this is the time to be very much focused. All right. Very much focused that now you need to turn to the exam mode, to the MCQ mode. All right. Till now, you may be preparing for your theory examination, but now is the time that you need to go through that question banks, uh, practice all these MCQs, and you have to be really focused. Now, if you are belonging to the working group, this is the time that you take a break from your work, all right? And you need to set a plan on how to go about the examination, all right? So whichever group you belong into, next couple of days is very crucial. set aside for planning. All right. So in your plan, in your preparation is the most important thing nowadays. All right. Uh, you need to have a proper strategy. Strategy is very important for success. We in emergency medicine and critical care, we always say, if you fail to prepare, then you are prepared to fail. All right. So next couple of days, take time to prepare yourself. Prepare a plan for yourself. All right. And while preparing that plan, you need to consider three things. You need to keep these three things in mind. First of all, the knowledge. Where do you stand in the knowledge pyramid? Okay, which is needed for the upcoming NEET SS critical care paper. And getting the right resources for uh, expediting your knowledge in the next couple of months. And finally, the timeline. All right, the timeline which you need to follow very rigorously in the next 10 weeks. So let's start with the timeline. First 2 days I already mentioned should be spent for planning. All right. And in that planning, you need to include or find out where your knowledge, where you stand in the knowledge pyramid. Okay. And I assure you that none of you belong to the base. All right. All of you have a good base in knowledge. If you have done your residency well in any of the specialty, you will be having a good base. All right. Now, the where you stand in the knowledge pyramid also depends on your underlying specialty, the specialty which you have undergone. Of course, um, if you have done medicine, if you were a postgraduate in medicine, you will be very good in that area. If you are from the pulmonology specialty, you might have much more exposure to critical care. Then if you are from anesthesia as well as emergency medicine background, you have a slightly, I would say, slightly higher advantage because you are exposed to both medical as well as surgical cases and even obstetric cases. All right. So a lot depends on the specialty from which you are coming, uh, on where you stand in that knowledge pyramid. All right. But most of you will be belonging to the somewhere in the middle, stage 4, or maybe in the stage 3, and some of you might be even in the stage 5. All right. But now is the time in the next 8 weeks. All right. You need to step up from each stage from where you are belonging to. All right. So these first 2 days, where you need to find out, you need to think for yourself, where do you stand, where do your knowledge gaps are, right? It's very easier said than done because most of you might be thinking that you are all the way down in the base of the knowledge pyramid. So one of the things which can help you to find out where you are belonging in the knowledge pyramid is by going through the question banks. All right. I wouldn't start with any textbooks. Okay, now is not the time to read any textbooks. Now is the time to be really smart. All right. So start with a question bank. All right. So from DocTutorials, we have a good question bank. Or if you're following any other resources, start with the question bank. All right. Try to find out where your knowledge gaps are. All right. Now, if you are not at all confident, then the basic book which I would recommend is ICU book by Paul Marino. The 5th edition was released last year in 2024. It's available online, or if you don't have it, I can send the PDF to you. It's the basic book, and if you have read this book, which you should have been doing it during your residency period, during your critical care postings. This is the book that most of the institutions will be following. It's a very good book to form the baseline. All right. I guarantee that you would get at least 50% of the answers correct in your NEET SS MCQ paper. All right. So up to 50%, you can get the knowledge from the ICU book. But it has about 53 chapters. It's very much concise. The size of the book don't let it fool you, all right, because it has a lot of content in it. So I wouldn't recommend that you go through this book page by page in the next 8 weeks of your preparation, all right. But if you have any doubts or any knowledge gap, when you go through the question bank, this is one of the books which I would tell you to refer. All right. It again depends on the question. If it's a basic question regarding any subject, this is the go-to book. All right. I don't want you to go through any other textbooks. Okay. Now, the next most important resource is going to be the video lectures. All right. So whatever beyond the ICU book by Paul Marino, you can get from these video lectures. All right. Especially from the DocTutorial side, we have been following Irwin and Rippey's Washington Manual of Critical Care, and even Tintinelli's textbook of emergency medicine. All right. So that would give you almost 95% of the knowledge bank which you need for the preparation. All right. So start with the question bank. If you have some doubts, the basic doubts regarding any topic, go and read the ICU book by Paul Marino, only those areas. All right. And something beyond the ICU book, you will be finding in the video lectures. All right. So even if you have been going through the ICU book through your residency time, now I wouldn't even recommend go back to that book unless you have some basic doubts. But you need to go through the video lectures. All right. Because all the updates, all the guidelines, then some of the recommendations from different societies, all these are you can find, all the studies, all these you can find in the video lectures. All right. So that should be the resource. These three things should be your only resource for the next 2 months of preparation. ICU book by Paul Marino, a good question bank, and video lectures. All right. Any platform. I'm a faculty. I'm Dr. Midhun Mohan, faculty from DocTutorials, and we have good video lectures as well as question bank in our resources. All right. Okay. So first 2 days is the planning to obtain all these resources in place to find out where you are in the knowledge pyramid. All right. And then the next 8 weeks should be dedicated for learning and testing yourself. All right. So when you're going through the question bank, don't go through each. When you're finding a new thing in a question, don't go and refer that in the ICU book of from any other resources. Try to do about 50 questions in one day, 50 or 100 questions in one day. Mark only those questions which you are having some trouble with. All right. And then find out the answers for that from the ICU book or from the video lectures. All right. That would be a smart way of proceeding in the next 8 weeks. All right. So in the next 8 weeks is where you build upon your knowledge. All right. Don't try to read on those topics which you are very familiar with. All right. So again, testing is also very important, but testing is not something which is going to determine your final rank. All right. This is just for you to get additional resources, because a lot of topics which we are not able to collect, which we are not able to accommodate in the video lectures or in the question banks, we might be putting that in the tests. All right. So don't worry if you get even low marks in these kind of grand tests or even mini tests that we are putting, but try to understand where the knowledge gap is. All right. And even if you don't go back and refer to those topics, see, if you have a lot of things to learn from each of these questions, especially like true or false, which one is the incorrect answer, because you will be learning at least 3 points, 3 correct points about a particular topic. So going through the questions, going through these tests is the most important thing in the next 2 months. All right. So always start with the question bank and then only refer back to the topics. All right. Okay. Now, the final 2 weeks is very crucial, and it's for revising and testing. All right. Revision, you need to revise only those topics which you are going to learn from now onwards. All right. Not the ones which you are familiar with for the last 3 years of your residency or which you daily practice in your clinic. All right. So only those new topics which you are going to learn in that knowledge gap which you have identified. Those are the things which you need to revise in the last 2 weeks. Don't try to revise everything. All right. Be confident in your knowledge base. Okay. Now, there also you need to undergo testing. All right. This testing will help you to build the confidence to help to manage the time. Okay. So last 2 weeks also you need to undergo these grand tests or even mini tests. Sometimes it's better to undergo the same test again if that is possible in the platform. All right. Okay. All right. So those are the most important things which I want to let you know. If you have any questions, I'm willing to take. And one very important thing is to take care of your health as well. All right. Uh, see, um, the preparation phase can bring a lot of stress for you. All right. Just thinking about the examination can bring a lot of stress. Okay. Stress happens when you're not prepared to handle any particular situation. All right. So you are going to prepare yourself and you are going to follow a plan. Building that plan is very crucial. Okay. So spend some time on it. All right. And trying to find your knowledge gap is not a single process. It's not something which you can find in the next couple of days only. All right. It's an ongoing process. All right. Now, taking care of your health is very important, your physical health as well as your mental health in the next 2 months. All right. So spend about 5 minutes in the morning. Close your eyes. If possible, if you know how to meditate, that's good. Otherwise, just try to recollect where you are each day. All right. What are the things which you learned yesterday? Only the main headings, main topics which you learned yesterday, and what is your plan for today? All right. Those are the only things that should be there in your mind on that day, what you're going to do today. All right. And talk with your family that this is your plan, that you don't want to get interfered with any other things. All right. And I think all your parents, your siblings, they will be, or your spouses, they will be happy to support you. All right. Okay. But be sure that you have a plan and you communicate that plan with your family members, with your friends. All right. Then get good sleep. At least 5 hours of sleep is a must. All right. Some people need more than 5 hours of sleep. It's fine. It's fine. All right. Eat healthy. Don't get too much stressed and rely on chocolate or even alcohol to get over that stress. All right. So eat healthy. Don't try to avoid all the junk foods. Eat a lot of fruits, a lot of vegetables. All right. Then exercise, moderate exercise, like taking a 20 minutes walk. That is worth it. All right. Don't think that you are wasting your time for the next 2 months. You have only 2 months to go, and you don't want to waste that 20 minutes. Don't think like that. It is worth it. All right. So if possible, in the morning itself, take a 20-minute walk, or in the evening. Okay. Go outside, get some fresh air. All right. If possible, do some push-ups, some squatting. Okay. So keep yourself healthy physically as well as mentally. It's very important, and that will determine your ultimate performance on the day of examination. All these things will accumulate, and it's very important. All right. Okay. And one thing that you should keep in mind is the reason why reason uh, which is driving you, why you are doing all these things. See, all of you have a specialty, right? And you are all good doctors, and you want to become a better doctor. You want to gain more knowledge so that you would like to help your patients in a better way. That's why you are doing this. Nobody is forcing you to take the NEET SS examination. This is your decision, this is your choice. So you take the responsibility of doing this, and you will not give up till you succeed. All right. But let not that interfere with your mental peace or your physical health. All right. Okay. Even if you do not get through the NEET SS paper, you can be a very good doctor, a very good successful doctor. All right. This is not the end of the world. Okay. It's just a beginning. All right. Okay. So if you if you'd like to follow the WhatsApp group, which is going to be active very much active in the next couple of months, you can follow this link to join the Target NEET SS by NISS Critical Care Group from DocTutorials. If you have any doubts and you want to contact me personally, you can contact me through WhatsApp. All right. So this is my WhatsApp QR link. All right. I wish all of you all the very best, and take care of yourself. All right. Plan, prepare, you will definitely succeed. All right. Thank you so much.